Let's take a closer look at the concept that context determines meaning. When we see the teardrop sign on a radiograph, it's important to remember that its significance depends heavily on where it appears. The teardrop shape itself is a radiographic appearance that can be seen in different regions, but its clinical meaning varies with each location. For example, in the cervical spine, a teardrop fracture indicates a specific type of injury, often a fracture of the anterior vertebral body caused by trauma. Moving to the orbit, a teardrop shape might suggest a blowout fracture, which involves the orbital floor or wall. In the ankle, the same shape could represent joint effusion, which is fluid accumulation within the joint, an entirely different issue. And in the pelvis, the teardrop is often a normal landmark, a key anatomical feature that helps us orient ourselves in imaging. So, understanding where the teardrop sign appears is crucial. It guides us to the correct diagnosis and influences how we manage the patient. This reinforces the overall theme that radiographic signs are meaningful only when interpreted within their specific anatomical and clinical context. Let's take a closer look at the cervical spine, and specifically the teardrop fracture. This type of fracture involves a triangular bony fragment that avulses from the front lower part of the vertebral body. Now, what's really important here is that there are two distinct types of these fractures, each with very different implications for stability and prognosis. First, we have the flexion teardrop fracture. This occurs due to a severe flexion compression injury, which causes the posterior part of the vertebral body to shift into the spinal canal. This type is considered highly unstable and carries a significant risk of spinal cord injury, so it's a serious concern. On the other hand, there's the extension teardrop fracture. This results from hyperextension injuries, leading to a small fragment at the anterior inferior corner of the vertebral body. Usually, this type is more stable, but it's important to remember that it often indicates underlying ligamentous injury, which can have implications for stability and treatment. Understanding these differences is key because they influence both the prognosis and the management approach in cervical spine trauma. Recognizing whether a fracture is flexion or extension type helps us assess the severity and plan appropriate intervention. Now, let's focus on the orbital floor blowout fracture. One key sign to look for is the teardrop sign, which appears as a soft tissue shadow on Waters' view. This shadow actually represents herniation of the orbital structures through the fractured floor. It's a crucial finding, but it's important to remember that it should always be correlated with the clinical presentation, and if needed, cross-sectional imaging like CT scans for confirmation. Speaking of radiographic appearance, you'll notice a teardrop-shaped soft tissue density extending into the maxillary sinus. This shape is quite characteristic and is best visualized on Waters or Caldwell views. However, to get a definitive assessment, CT imaging is the gold standard because it provides detailed information about the fracture and herniation. Clinically, patients often present with diplopia, especially when gazing upward, due to muscle entrapment or swelling. They might also have restricted eye movement, which raises concern for muscle entrapment. This is a serious issue because, in some cases, surgical intervention may be necessary to free the entrapped tissues and restore normal function. Overall, understanding these radiographic signs and clinical features helps us identify orbital floor fractures early and plan appropriate management to prevent long-term complications. Let's take a closer look at the ankle effusion sign. On lateral ankle radiographs, one of the key features to look for is the teardrop sign. This appears as a teardrop-shaped opacity located anterior to the talar neck. Essentially, it represents a joint effusion, which can result from trauma or inflammation. Recognizing this subtle but important finding can really help us make a diagnosis, especially when fractures are not clearly visible on the X-ray. This teardrop sign is particularly valuable because it helps us detect effusions that might point to intra-articular injuries or even occult fractures, those hidden fractures that don't show up on initial images. So, in the context of ankle injuries, keeping an eye out for this sign can provide critical insights, guiding us toward more accurate assessments and better patient management. This is a perfect example of how subtle radiographic clues can significantly influence our diagnostic process. Let's take a closer look at the pelvis and its normal anatomical landmarks. Here, we see the pelvic teardrop, which is a key radiographic feature. This shape is formed by the acetabular floor and the medial wall of the acetabulum. It's quite a consistent and recognizable contour on hip X-rays. The importance of this landmark lies in its role as a reference point. By identifying the pelvic teardrop, we can better understand the normal anatomy and alignment of the pelvis. This helps us avoid misinterpretations that could lead to unnecessary concern or missed diagnoses. Understanding this normal variant is crucial because it anchors our radiographic orientation. When we know what normal looks like, it's easier to spot abnormalities and assess the integrity of the hip joint accurately. This knowledge ties into our overall goal of accurate radiographic interpretation and proper diagnosis. Let's take a closer look at the comparative summary. This slide emphasizes the importance of a systematic understanding of the teardrop sign across different regions to prevent diagnostic errors and ensure appropriate clinical management, all based on the anatomical context. Starting with the cervical spine, when we see a triangular bony fragment, often related to flexion or extension trauma, it's crucial to recognize that a flexion-type injury can be unstable and pose a risk for spinal cord injury. Identifying this sign helps us evaluate the severity and plan proper intervention. Moving to the orbit, a blowout fracture can produce a soft tissue tear drop in the sinus. This sign indicates herniation or entrapment of soft tissue, which often requires further imaging like a CT scan for detailed assessment. Recognizing this early is vital for prompt management. In the ankle, the presence of an effusion appears as a teardrop density at the talar neck. This is an important indicator of joint effusion resulting from injury, guiding us toward appropriate treatment to address the joint trauma. Finally, in the pelvis, normal anatomy is characterized by a smooth acetabular contour. Recognizing this normal landmark provides a reference point, helping us distinguish between normal and pathological findings in pelvic imaging. Overall, understanding these variations of the teardrop sign across different regions allows us to make more accurate diagnoses, avoid mistakes, and tailor our management strategies effectively. Let's take a closer look at the radiological interpretation principles related to the teardrop sign. The key thing to remember is that the clinical significance of this sign is entirely dependent on the context in which we see it. Misinterpretations often happen when radiologists overlook the importance of anatomical location, so it's crucial to consider where exactly the sign appears. Each variant of the teardrop sign requires a different diagnostic approach and management pathway. For example, in the cervical spine, seeing this sign can indicate major trauma with potential spinal cord injury. If we notice a flexion-type teardrop sign in this region, it demands immediate immobilization and urgent consultation with a neurosurgeon. Moving to the orbit, the teardrop sign here usually signals a fracture with herniation of muscles or fat. This situation calls for a CT scan to confirm the fracture and an ophthalmologic assessment to determine if surgical intervention is necessary. And in the ankle, the teardrop sign suggests joint effusion, which points to intra-articular injury or pathology. Depending on the findings, management might involve further imaging or simply close clinical observation. So, understanding the specific location and context of the teardrop sign helps us make accurate diagnoses and choose the best treatment options. This highlights the importance of integrating anatomical knowledge with radiological findings in our practice. Let's go over some key takeaways to keep in mind when interpreting these signs. First and foremost, always identify the anatomical location before jumping to conclusions about the teardrop sign. Understanding where you are looking is crucial because it guides your interpretation accurately. Next, remember that flexion is a critical factor. For example, if you see a cervical flexion teardrop, that's a red flag. It indicates an unstable injury and a potential risk for spinal cord injury. That's a serious finding that demands careful attention. When it comes to orbital fractures, the orbital teardrop sign requires further investigation with a CT scan and ophthalmologic assessment. It's not enough to just see the sign. You need to correlate clinically and radiologically. In ankle injuries, an ankle teardrop suggests joint effusion resulting from trauma. It's a helpful indicator of swelling inside the joint, which can influence your management approach. Now, a quick note on normal anatomy. The pelvic teardrop is actually a normal contour, a reference landmark. So not every teardrop shape indicates trauma. Sometimes it's just normal anatomy. Finally, a clinical pearl to keep in mind. The context in which these signs appear really determines their significance. Never make assumptions based solely on the appearance of a sign. Always consider the overall clinical picture to guide your interpretation. So, in essence, pay attention to location, understand the importance of flexion, and always interpret signs within the broader clinical context. That's how you ensure accurate and effective assessments. Not every teardrop is a fracture, and that's a crucial point to remember. But at the same time, every teardrop shape we see on an image demands careful contextual analysis. It's not enough to just note its presence. We need to interpret it accurately. To do that, we have to understand the anatomical location, where exactly it's appearing, and the mechanism of injury, how it happened, and also the clinical presentation of the patient. This disciplined approach, combining these factors, really sets apart expert clinicians. It's what allows us to distinguish true fractures from normal variants or other findings that might look similar. And ultimately, it helps us provide the best possible care for our patients. The teardrop sign, for example, highlights why radiology isn't just about technical skill alone. It's about applying that skill within a broader clinical context. The same radiographic sign can mean very different things depending on where it's found and the patient's overall picture. So, understanding that context is what makes all the difference in accurate diagnosis and effective treatment.